We're going to show you now the normal and pathological conditions of the pericardium. And we are going to show you hemopericardium, constricted pericarditis, and some pitfalls of the interpretation of the ascending aorta due to the distension of the juxta-aortic pericardial recesses. The pericardium is an envelope which surrounds the heart. In a normal individual contains a very small amounts of fluid, and actually the pericardial cavity is not visible radiographically unless there is separation of the visceral from the parietal pericardium. Note in these four images, the first one, a coronal section close to the sternum, the envelope of the pericardium, surrounded by epicardial fat medially and mediastinal fat laterally. Note that some branches of the coronary arteries and veins are seen in the epicardial fat around the left ventricle. The second coronal image is dorsal to the previous one, showing the pericardial envelope. Note that cephalically it stops close to the pulmonary trunk. The superior aspect of the pericardial sac covers the ventral aspect of the great vessels, and dorsally it is not seen going as high as ventrally. Note in the sagittal section the pericardial stripe formed by the apposition of the visceral and parietal pericardium. Note that we can see a slit-like space that represents the pericardial cavity. And finally, the axial section of the heart shows the pericardial stripe as a thin, dense envelope surrounded by the low-density structures that represent the epicardial and mediastinal fat. When there is a fluid in the pericardial cavity, we can see several of the pericardial recesses. In this cross section, you can see distended recesses lateral to the great vessels and dorsal to the ascending aorta. This is a pair of CT sections of the heart where we can see the superior pericardial recess outlined by the arrows in the picture to your left. The picture to your right, we can see the dorsal pericardial recess, or the so-called transverse recess, which is noted behind the ascending aorta, and sometimes it can simulate a dissecting hematoma. The next four images are of a patient with pericardial effusion. Note the distension of the transverse and left pulmonary recesses, and note that they sometimes can produce focal densities behind the ascending aorta, as seen in the second picture, or to the left of the ascending aorta, as seen in the second picture of this second slide. The last two images reveal a distended superior or transverse recess of the pericardium in a patient who had a dilated aorta. And finally, the last CT images are sequential images of a distended pericardial sinus, which simulated a dilated ascending aorta or a dissecting hematoma of the ascending aorta. This patient had a ruptured heart following a myocardial infarction. Note the accumulation of blood surrounding the heart. In patient with constrictive pericarditis, we may see uniform or irregular thickening of the pericardium. When one sees the thickening of the pericardium at the level of the atrioventricular groove, it is not uncommon to note the distension of either the inferior vena cavas, in this case, or the superior vena cava. These are individuals who present with distended systemic veins, and By CT, one can demonstrate the cause of the distension by observing the thickening of the pericardium.